Let's talk about one of the important vitals that you will assess as a first responder, and that's the blood pressure. So, what is blood pressure? Blood pressure is the measurement of force applied to artery walls. So, if we're talking about the pressure that's applied to artery walls, then why are there two numbers? There's two numbers in a blood pressure because the heart beats in two phases. We have systole and diastole. So, systole is when the ventricles or the bottom of the heart contract and they send a wave of blood throughout the body, which we know and we feel as a pulse. So, systole again is when the ventricles contract and they send that wave of blood throughout the body. The bottom of that heart contracts and it's sending it out. So, we see it squeezing and we feel that pulse come through. So that's our first number, and that is the high pressure number. That is the highest number because this is when the pressure is the highest out in our body. Diastole is when the ventricles or the bottom of the heart relax and fill while the top of the heart is contracting. So the ventricles are relaxed, and so at this point, this is the time between the pulse waves, the pulse that you feel. This is that absence of the pulse. This is that moment of low pressure. So we represent it by writing the systolic pressure when the ventricles are contracting over the diastolic pressure, which is when the ventricles are relaxing. And so a perfect blood pressure, depending on what text you're reading, is 120 over 80 or 110 over 70 or somewhere in between. That's a normal relative, that's the healthy blood pressure number for an adult. Writing a blood pressure, when we write it like this, remember it's going to be an improper fraction. When I was growing up, we used Dolly Parton as an example in middle school math to learn about improper fractions. Big on the top, small on the bottom. Remember that the systolic pressure always goes on top. So understanding this, again, the highest pressure inside the patient's arteries is the systolic pressure. And the lowest pressure inside the patient's arteries is the diastolic pressure. So when we're having those two numbers, it's because there's two different pressures inside of those arteries. So it's when it's actually pumping hard and when it's relaxing. So when it's contracting and relaxing, and we're talking about the heart and the ventricles specifically. So that's why we have those two numbers. So now we're looking at different categories for your blood pressure. So we've got our three columns here, and it tells you what the blood pressure category is: systolic pressure and diastolic. So for your blood pressure to be normal, it should be, and when we say normal, we're talking about at rest. If you're dealing with a patient who just ran a mile, their blood pressure is going to be high. It should be higher than normal. So normal here is a systolic pressure of less than 20 and less than 80. As we go down through here, and you can pause the video and look at each one of these, notice that the first two are an and statement, meaning that it's really hard to be in those two stages compared to an or situation here. So if we go to that orange section where it says high blood pressure, hypertension stage 1, it has, all you have to have is a systolic of 130 over 70, and that's still considered stage 1 hypertension. Or you could have a blood pressure of 119 over, or 118, because we're taking manuals here, we're not taking automatics, 118 over, let's say, 88. At that point, you're still considered stage 1 because it's either or. It's either the systolic or the diastolic that can put you in this category. So for your stage 1, stage 2, and then a hypertensive crisis, they are or statements. Now with the hypertensive crisis, it can be and because there's nothing higher than this. If you have a patient who's in a hypertensive crisis and they're at rest, they need to go see their doctor and be evaluated. They're going to have to take some blood pressure medication to help lower that. If they're on blood pressure medication and they've skipped it, this may be the cause for it, but they need to get immediate help with this. So if you see these numbers, that would be a point to get concerned at. So the actual process of checking a blood pressure, let's walk through this. So the equipment that you're going to need, is a stethoscope, and you don't always need a stethoscope, but you do always need a sphygmometer, also known as your blood pressure cuff. So you need those two things. The whole process from the very beginning, before you even put the cuff on the arm, you're going to find the brachial artery. You can do this with a stethoscope, or you can do this by feeling. The brachial artery that you're going to be assessing the pulse point that you're looking for is going to be in the crease of the elbow. You can start by finding the brachial artery in the just between your bicep and your humerus. If you're pressing in from the medial side of the arm, you should be able to feel that artery, and you can trace it around to the crease of the elbow if you're having difficulty. Make sure that you select the correct cuff size. So there is a range size on every blood pressure cuff that you're going to have. It should be there, and when you wrap it around, the end of the cuff should be within that correct sizing. If it's too large or too small, you'll get an inaccurate reading. So after you've figured out the correct size, you're going to place the cuff on the arm, approximately 1 inch above the pulse point, and then you're going to ensure that the artery line on the blood pressure cuff itself is lined up with the artery and where you found it. Now you're going to take the bell of the stethoscope and add a little bit of pressure and listen as you pump your blood pressure cuff up. You should hear that pulse disappear as it increases, and once you're there, you're going to release the air slowly, and you're listening for when it returns. And that first time that you hear that pulse come back through, that's your top number. That's your systolic pressure. And then you're going to keep listening all the way down until it disappears. And when it disappears, that's your bottom number, and that's your diastolic pressure. So that's the whole process. When we go to pump it up, we're going to pump it up no higher than 180, okay? If you pump it up to 180, and as soon as you put the bell on, you still hear that pulse coming through, at that point you can increase, but otherwise don't go above 180. It's extremely uncomfortable for the patient and oftentimes unnecessary. Then you're going to let it down, which is represented on this by that yellow arrow, and then we hear our first sound, and if it's a perfect one, we'd hear it at 120, and then we keep hearing that pulse as it's going down, all the way to 80, and then after 80, we don't hear the pulse anymore. So we would write this as 120 over 80. When we're looking at this, you need to know that these tick marks are even. So each tick is an even number. Manual blood pressures are always even. If you're trying to look in between those tick marks to get a very precise number, you're going way too far on what you're trying to do, because it's not going to help you with your accuracy. It's going to be with a tick mark, okay? So just know that those ticks are going to be even numbers. It's 2 in each, okay? If you have an issue with your blood pressure and you just don't hear it, then you're going to start at your ears and work towards the patient. Are the ears turned the right way? If you take your stethoscope and you put them in your ears, it should be pointing forward. Those ear pieces should be pointing forward into your ear canals. If you took the stethoscope itself and it was pointed the right direction, the arch of the stethoscope would be touching your cheeks, and then the other part would be hitting your nose angled out. If it's angled in the other way and it's not resting at your cheek, you've got them backwards. The next part is make sure there's not a kink in the line. And this could be on your stethoscope, but most likely this is going to happen on the blood pressure cuff. Just make sure that there's no kinks. Make sure that the bell is turned the correct way on your stethoscope. Most stethoscopes are going to allow you to click them into 2 different positions, and you can test this by tapping on the bell, click it, and then tap the bell again. Whichever side is louder is the side you need to be using. It's also possible that you put too much pressure or not enough pressure on the bell, depending on what kind of stethoscope you're using, and making sure that you are lined up where you need to be kind of dictates how much pressure you're going to put. So adjust the amount of pressure that you're using on the bell. And if you can't hear it, there's always palpation. And so we write this, or we actually take a blood pressure by finding the radial pulse, line your fingers up, you've got it, hold it, Hold on to that pulse. Don't change your pressure, because you can push through that pulse and cut it off so that you can't feel it anymore, or you can let go and not feel it. So make sure that you're being steady with your pressure, and you're going to air the blood pressure cuff up until you don't feel any pressure anymore, and then you're going to release it. And when you feel that pulse come back through, that is your systolic pressure. When you do a palpated blood pressure, you do not get a diastolic pressure. You just write it as whatever your top number, systolic number, is over P for palpation. And that's okay. This is acceptable, and we use this in the back of the ambulance sometimes when it's really loud, or if we're in a really loud environment. A palpated blood pressure is okay when you can't get an auscultated blood pressure. So this just shows you exactly what that looks like and how we write it. So finding that pulse, make sure that you keep your pressure on the pulse steady as you inflate and deflate your blood pressure cuff. So that's the down and dirty, the basics of a blood pressure and understanding what you're actually measuring. It's really important as you further your education that you understand why you do what you do. If you are just a person who is obtaining numbers and you don't know what they mean or what they're actually telling you, then you might as well just be a machine and not interpreting what you know. So understanding what you're doing is really important, and I hope that this helped you understand what a blood pressure is and the proper way to take one. Again, if you have questions, always feel free to ask.